How you doing? I'm going to talk a little bit about autism today. Um, More specifically focused on the effects that autism has on children and adolescents in the African American community. I hope you enjoyed some of the videos that I posted that's focused on some of the effects that autism has in the African American Black community and some recommendations on how to help and support that specific population. Autism in the Black community, I think, is just a lack of knowledge on the part of African American families about what autism is, as well as cultural insensitivities or racism on the part of doctors and other professionals who evaluate children. I thought it was important to post this quote and so it can actually focus on some of the cultural and historical issues that has plagued the African American community dealing with autism. And I'll make sure to elaborate a little bit more on some of these issues aforementioned during the PowerPoint presentation. Some quick facts on autism. Autism spectrum disorder is a complex neurodevelopmental disorder characterized by impaired social communication and social interaction and unusually restricted repetitive behaviors and interests. It is estimated that autism spectrum disorders affect 1 in 500 live births per year. About 1 in 68 children has been identified with autism spectrum disorder, according to estimates from CDC's Autism and Developmental Disabilities Monitoring Network. In 2005, the average annual medical costs for Medicaid enrolled children with ASD were $10,709 per child, which was about 6 times higher than costs for children without ASD. Individuals who suffer from a disability are often not able to contribute to society to their fullest extent and suffer from physical and mental health problems. Autism can strain family relationships and increase stress levels. Autism is usually not diagnosed until the age of 3 years, which makes it difficult to provide intervention early enough for it to be optimal. Health disparities in the diagnosis and treatment of autism may be exacerbated by broader social problems such as higher unemployment rates, higher rates of uninsured families, and lack of access to services due to geographical region or discrimination experienced by African Americans. Okay, so because there are such a wide variety of autism types and spectrums, it can be difficult to group a child's symptoms together. I just wanted to make sure I provide a look at 6 main types of autistic disorder and the very basic markers. Just a quick overview of the different disorders: autism or autistic disorder, regressive autistic spectrum disorder, pervasive developmental disorder, Asperger's syndrome, childhood disintegrative disorder, and Rett syndrome. Autism or autistic disorder, a collection of developmental disorders in which a child engages in repetitive behaviors and has trouble communicating and connecting with others. It's usually diagnosed around age 2 or 3, although some signs show up earlier. Symptoms can be mild to severe. Classic warning signs of autism include lack of eye contact, failure to point, lack of development of language or communication skills, repetitive behavior, a preference for being alone instead of playing with peers, and a lack of imaginative play. Regressive autistic spectrum disorder. Like autism, except that a child appears to develop normally until 18 and 24 months, then starts to regress. It occurs in about 20 to 30% of children with autism spectrum disorder. As you've seen or may have seen in the video that I posted, a mother speaks about her child which has regressive autistic disorder. It speaks to some of the symptoms and what one how one acts with that disorder. Pervasive developmental disorder. A child has a few autistic traits but doesn't meet the full criteria for an autism diagnosis. As such, PDD became the diagnosis applied to children or adults who are on the autism spectrum but do not fully meet the criteria for another ASD, such as autistic disorder. A high-functioning group whose symptoms largely overlap with that of Asperger's syndrome, but who differ in terms of having a lag in language development and mild cognitive impairment. Asperger's syndrome does not generally involve speech delay or cognitive impairment. A second group whose symptoms more closely resemble those of autistic disorder but do not fully meet all of its diagnostic signs and symptoms. A third group who meet all the diagnostic criteria for autistic disorder but whose stereotypical and repetitive behaviors are noticeably mild. Asperger's syndrome, a milder form of autism, usually diagnosed between ages 2 and 6, in which a child has good language skills and average to above average intelligence, but is socially awkward and engages in odd, repetitive behaviors. Childhood disintegrative disorder, a very rare disorder in which normally developing children lose motor, language, social, and potty skills around age 2 to 4. Rett syndrome, an extremely rare disorder similar to CDD, which occurs only in girls. Autism in the Black community. African American children have similar prevalence rates of autism as white children, although they are diagnosed later. Autism occurs 3 to 4 times more often in males. African Americans tend to suffer disproportionate rates of disability and disease when compared to other racial and ethnic groups due to access to preventative and curative care. In 2002, white children were diagnosed, on average, at 6.3 years old, versus black children, who were diagnosed at an average of 7.9 years old, according to a study conducted in Philadelphia by the University of Pennsylvania. Due to many of these aforementioned facts, African American children may require longer and more intensive intervention. Medical issues. The history of health and treatment in America towards African Americans has made many blacks weary of the entire health system. Because of this, many black Americans have learned over time to distrust the medical community. In the past, African Americans were refused service at some of the better hospitals, even at times in serious medical emergencies, and forced to travel long distance to receive proper treatment. Some of you all may know about the Tuskegee experiment, which made a huge effect on the black community during the early 1930s up until the 1970s. Tuskegee's experiment focused on where blacks were purposely refused treatment for syphilis without their knowledge in the name of science. This experiment lasted 40 years, from 1932 and 1972. African Americans are less likely to seek treatment, and when they do, they tend to have shorter courses of treatment. Children of color are more often diagnosed or not properly treated for these disorders than their white counterparts. Okay. African American parents were less likely than white parents to agree with teachers that their children's behavior was indicative of an underlying disorder. How parents interpret these symptoms may have a critical impact on the type of treatments they use or whether they elect to engage in treatment at all. African American children require 3 times the number of visits over a period of time as long as European American children before receiving an autism diagnosis. Educational issues. It is well known and documented that urban school districts and even some older inner-ring suburban school districts are underfunded and in dire need of finances and even restructuring. Most serve a high percentage of children living in poverty and those who are not English proficient. This requires additional funding to provide these extra services. However, funding is usually not adequate. Since schools are funded largely by local property taxes, middle-class suburban districts have seen their tax base grow while older districts have seen them shrink. Although it is the doctors who usually see the first signs of autism. It's the school districts who provide treatment for those who cannot afford private treatment, since health insurance does not cover most autism related services, but most black children are served by their local public district. And lastly, wanted to just provide some recommendations for family members that may know of um, children with autism, and also specifically towards the African American community to help support this population. I believe taking children to the doctor regularly and being seen by the same physician would be helpful. Patients who see the same doctor regularly have an opportunity to build a good relationship with them, therefore receiving higher quality care. This could help counteract any of the perceived stereotypes doctors may have of African American children. It is okay to second guess your family's opinion if you suspect your child may be developmentally delayed. Many families in the African American community may forego and not adopt a decision that a doctor has made on their child because they think it's maybe just a behavioral issue. But sometimes it's more of a developmental issue and not just focus on their behavior. If there is something that needs attention, it's always better and more effective to intervene sooner than later. And the Special Needs Network, it's always important to also get involved in the community with nonprofit organizations or other organizations that focus on autism, and also in the black community to help foster support and care for the population. The Special Needs Network is a community-based nonprofit organization focused on serving children and families with autism and other development disabilities. I hope you're able to take some good recommendations and knowledge from this presentation. And also, if you haven't done so far, please review the videos, and you'll be able to gain a better understanding of autism in the African American black community, and some of the reasons why autism is not diagnosed during the same time, the same age as white children in other populations, and also some ways to help support this community. Thank you.